It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Now, if you've ever had a time where you're having trouble breathing, you'll know that it can be very stressful. Up next, we're going to hear about nasal congestion and inability to breathe with ear, nose, and throat specialist, Dr. C.T. Nguyen.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, over the age of 40, who a lot of times, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
In today's Ask the Doctor, Ricardo from Houston has a question for Dr. Annie. Do all heart attacks cause chest pain?
That's a fabulous question. Very important for people to know that 50% of the time, people with coronary disease don't even have chest pain. They don't have any symptoms. So sometimes people can have a heart attack and not have chest pain. Sometimes people can have chest pain but not be having a heart attack, but just have something called angina, or decreased blood flow to the heart. Whatever the symptom is, whether it's chest pain, shortness of breath, palpitations, just a funny feeling in the heart, oftentimes women may say that they just feel less able to do the things that they do, less able to take care of the things in their household daily environment. So if people have symptoms, definitely they should be checked. If they don't have symptoms, they just are worried about heart attack or stroke or family history of heart attack, just go and see your doctor. Every physician is able to evaluate the heart. You don't have to go to a cardiologist. You can start with your primary care doctor that can give great care, and then go and see a cardiologist for further evaluation.
If you haven't read one of our Best Docs Network magazines, just head to our website. It's bestdocsnetwork.com and check out the digital version. Now, up next on the show, we're going to be hearing about cool sculpting with Dr. George Davis.
I've always been slim, or on the slim side. Always had a little pooch for a tummy, but it wasn't anything that I couldn't, cover up in clothing or suck it in. And then, I wake up one morning and just went, what's this? And it didn't matter how much I exercised, I've always ate well. I could not get that stomach to go down, and it happened in the upper section also.
Our patient for cool sculpting came in for abdomen treatment, very concerned about her stomach. She had areas that she couldn't get off despite diet and exercise.
So I just went, clothes aren't fitting, I can't go on like this. And so I started researching, and I decided on the cool sculpting simply because it's non-invasive. I didn't want to go under the knife.
So the cool sculpting procedure will take about an hour. It is non-invasive. When the procedure is done, you can go about your daily activities. You'll see the most results at about 2 months. So the whole concept is you can take the skin and the soft tissues to a lower temperature, freeze the fat, which actually kills the fat, but it leaves the surrounding tissues intact.
Of course, you get the list of what could happen, and I didn't have any cramping. I did have just ever so slight bruising, not purples and blues, just a little red and a little tender, and that was it.
It is permanent. The affected area will kill about 25% of the fat cells. The recommendation these days is to do 2 treatments within a month so that we can get about 50% reduction of the area. Some patients just need 1 and they're happy with it, but a lot of patients can get 2 and get better results.
I had it a year ago last January, yes, and I'm just really thrilled that I had it done. My clothes fit again. I could not wear this skirt a year ago, and it was cheaper to have it done than going out and buying a new wardrobe. Simple as that. I would say I'm a victim of fashion, and I like feeling good in my clothes. I like to look good. And so, yeah, there's a little vanity in there. And the hubby kind of likes it too.
Let's talk about gluten sensitivity. You hear a lot about that. People with gluten sensitivity tend to get bloating, gaseousness, but it also can cause things like anemia or fatigue because it washes out your nutrients in your body and causes changes in everything from your energy level to your tests in your doctor's office. Gluten sensitivity is caused by the absence in your small intestine of an enzyme that digests gluten. Gluten is like wheat, breads, and that kind of thing, and starches. If you don't have that enzyme, you build up gas from all the gluten that we tend to get in our diet. How can you tell if you're gluten sensitive? Well, one way is to just take gluten out of your diet. All you have to do is look on the internet and you'll find gluten-free diets. If you get better from your symptoms that worry you by being on a gluten-free diet, then you probably do have gluten sensitivity, and just keep on keeping on that way. Now, one way to tell for sure is you can get a biopsy done in a doctor's office with a scope down your throat, but that's not the best way to do it. Just get a blood test done if the dietary restrictions don't work.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Yashova came to my office complaining of fungal toenails. Very common thing, especially, you see it in summertime. It's very prevalent. It's a fungal infection of the nails. The nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have everything perfect. So it's one of the things when I found out that something is wrong. I couldn't go for some time because I was busy, but I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
For more information and to check out hundreds of videos or request an appointment with any of our amazing physicians, head to our website. It's bestdocsnetwork.com. Now up next, we're going to hear about irregular heartbeats with interventional cardiologist Dr. Annie Varughese.
I was quite tired, and I travel considerably, and at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
Pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fix those, but what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart, but then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varughese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
I kind of came to a realization that I obviously was not healthy, and it got to the point where it was kind of borderline embarrassing going shopping, and I would shop for clothes and I would cry in the dressing rooms, and I realized at that point it wasn't 5 pounds that I had put on, it wasn't 10 pounds, it was I had gained about 100 pounds without really even, I can't say I didn't know it, but I think I was kind of in a state of, well, denial.
Stephanie's lost all of her extra weight, so that's ideal. That's not, we don't expect that, we hope for that, and she's achieved that. She's achieved it because the surgery's given her a lot more control, but she's exercised that control.
I got the surgery March 5th of 2012, and currently I've lost about 115 pounds.
But she's really changed how she eats and limited it to very healthy things, natural things, local, organic things, all of which have pretty much a low glycemic index. She's cut out almost all the animal fat out of her diet, and then that's ideal.
Everything has changed. Just a different joy. My kids are proud of me, and at work, working is easier. I realized that it was absolutely the best thing that I ever did, not only for my life right at this moment, but for my life forever.
Her whole approach to eating has changed, and she's involved her family and friends and coworkers in that, and that will produce an effect known as the halo effect, which is that patient having the weight loss surgery can actually transmit better lifestyle to some of the people around them, and those people actually benefit from that.
And so everything has changed. How I saw myself, how I see myself, how I see food, how I cook, how I shop, everything. Totally, like, I feel like a totally different person.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com. Eating potassium-packed picks such as bananas, cantaloupe, and oranges may help you to be less prone to high blood pressure. In addition, reducing sodium intake and taking other heart-healthy steps will also help to manage your blood pressure. Did you know you can request an appointment with any of our amazing physicians that you'll see on the show today? Just head to our website. It's bestdocsnetwork.com. And you can even request an appointment with our next physician. It's plastic surgeon, Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breast with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get what would you say, a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
For dry skin, incorporate more avocados into your diet. They're rich in monounsaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their 3rd set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Hi cholesterol is a major problem in this country as well as in many countries around the world. High cholesterol leads to atherosclerosis, blockage of arteries that affect many organs throughout our bodies. So how can we effectively treat high cholesterol? There are medications, but sometimes medications can cause multiple problems for patients, multiple side effects, muscle pain, weakness, breakdown of muscles, liver dysfunction, to name just a few. So we know that natural has always been the best, and we look for natural therapy with regard to cholesterol reduction. There is something that we use called Bio's Life Slim, which is a fiber product created at Stanford University about 20 years ago to treat high cholesterol in those patients who are intolerant to medications. It's been there for 20 years, but not many people know about it. We use it in our practice, and we've taught many doctors how to use this effectively to lower cholesterol. LDL is lowered by 30%, triglycerides lowered by about 50%. So ask your doctor about Bio's Life Slim. Look for it. It's an amazing therapy, and it will help you to change your life.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1 3/4 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Well, it has been an amazing episode of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really making a difference in people's lives. If you have a question or a comment, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. And to check out hundreds more videos and any information that you could need, head to our website, bestdocsnetwork.com. Thanks for tuning in, and I'll see you next week.